Hello, and welcome to a training session brought to you by Early Years Unfolded. In this session, Early Childhood Development Milestones, What to Expect, 0 to 12 months, we'll take a closer look at the amazing journey of infant development during the first year of life. This training is designed to help you better understand your baby's growth and development during the first year of life. We'll explore typical developmental milestones, ways to support your infant's learning through everyday activities, and how to recognize when extra support might be needed. Our goal is to give you the tools, knowledge, and confidence to celebrate your baby's progress, encourage healthy development, and feel empowered every step of the way. So, why does this training matter? First, we'll work on increasing your awareness of typical development. You'll learn what to expect at each age and stage, from head control and rolling over to early communication and social bonding. Knowing these milestones helps set healthy expectations and celebrate every success, big or small. Next, we'll focus on supporting the early identification of delays. When we know what's typical, we can more easily recognize when something might be off track. Early identification means earlier support, and that can make a lasting difference in a child's growth and learning. And finally, we'll explore how to promote developmentally appropriate practices. You'll discover how simple, everyday routines like tummy time, singing, or mealtime interactions can be powerful learning opportunities when tailored to a child's developmental stage. By the end of this training, you'll feel more confident in recognizing key developmental milestones, having meaningful conversations with families, and creating nurturing environments that encourage healthy growth. Let's dive in and learn how to support every child in reaching their full potential, one milestone at a time. In the first year, babies grow quickly from automatic newborn reflexes to intentional actions. They build strong emotional bonds with caregivers and start exploring their surroundings through touch, sight, sound, and movement. Brain development is rapid by age 3. About 80% of the brain's growth is complete. Infants learn best through sensory experiences and responsive interactions with caring adults. Infants experience remarkable motor development during their first year of life. At birth, newborns have very little head control. However, by 2 to 4 months, most babies are able to hold their heads up and push up when lying on their tummies. By around 6 months, infants typically roll over, and many begin to sit independently between 6 and 8 months. Around 9 months, babies often start crawling and may also pull themselves up to stand between 9 and 12 months. By 12 months, some infants take their first independent steps, although it is normal for walking to occur anytime between 9 and 15 months. In the first year, babies begin to actively explore the world around them. They use their senses to learn, looking at, mouthing, and shaking objects to discover what they are and how they work. During this time, they also start to understand cause and effect, for example, shaking a rattle to hear the sound it makes. By around 9 to 12 months, many infants will imitate simple actions they see adults perform. They may pretend to drink from a cup, brush their hair, or use familiar objects in ways that show early understanding of their purpose. These small but important steps are the building blocks of early thinking and problem-solving skills. During the first year, babies make exciting progress in their language development. Early on, infants turn their heads toward sounds and pay close attention to voices around them. By around 4 to 6 months, most babies begin to coo and babble, making joyful sounds as they experiment with their voice. Between 6 and 9 months, babies typically respond to their own name, showing growing awareness of language and connection. By 12 months, many infants can say simple words like mama, dada, or oh, although they may not always use these words specifically at first. By the end of the first year, babies also begin to use gestures, like pointing to objects or waving to say goodbye, as early forms of communication. These early milestones lay the foundation for strong language and social development. Now that we've explored how infants grow and develop in their first year, let's shift our focus to how we can best support them through developmentally appropriate practices, simple, meaningful ways to nurture their learning and growth every day. Let's take a look at social and emotional development during the first year of life. By around 2 months, infants begin to recognize familiar people and often respond with social smiles, showing early signs of emotional connection. Between 6 and 9 months, babies enjoy interactive play games like peek-a-boo become exciting ways for them to engage and bond with others. As attachments to caregivers grow stronger, babies may begin to show stranger anxiety, crying, or showing distress around unfamiliar people or become upset when separated from a parent. This separation anxiety typically peaks between 8 and 12 months. Infants also start to respond to the emotions of others. For example, they may frown if they hear someone yelling or show joy when someone smiles at them. They may stop an action when hearing no or respond differently to happy and firm tones of voice. These early emotional and social milestones lay the foundation for trust, communication, and healthy relationships in the years ahead. Provide warmth and security. Respond promptly to infants' cries and cues. Consistent, loving responses help babies develop trust and emotional security, forming the foundation for all learning. Talking, singing, and making eye contact during routines, feeding, diapering, bath time, foster attachment and communication. Promote language through interaction. Speak frequently to the baby in gentle, rich language. Describe what you're doing, name objects, here's your bottle, and engage in serve and return interactions, baby coos, and you respond enthusiastically to build language pathways. Imitate the baby's sounds and encourage back and forth conversation. Reading books aloud and singing songs or nursery rhymes, even to newborns, supports early language development. Encourage sensory exploration. Babies learn by using their senses. Offer a safe environment for free movement. Allow supervised tummy time on the floor to strengthen muscles and place interesting, non-choking hazard, objects within reach to grasp and mouth. A Montessori-inspired infant environment might include a soft mat or floor bed, a baby-safe mirror, and simple mobiles or rattles to explore, promoting freedom of movement and concentration. Play and cognitive stimulation. Use simple games to support cognitive and social skills. For example, Peek-Boo teaches object permanence and is fun for 6 to 9-month-olds. Provide toys that react to actions. A rattle makes noise. A soft block can be squeezed to teach cause and effect. Rotate toys to introduce novelty, but not so many as to overwhelm. Infants focus best on one object at a time. Support physical development. Encourage gross motor skills by giving infants daily tummy time, which builds neck, back, and arm strength for rolling and crawling. Place toys just out of reach to motivate scooting or crawling. When the baby is ready to stand, ensure they have safe furniture, low, sturdy surfaces, or activity tables to pull up on. For fine motor practice, offer objects of various textures and shapes to grab, transfer between hands, and bang together. Adapt to individual pace. Remember, each baby develops on their own timetable. Watch for cues of readiness and interest. For example, if an infant reaches for a toy, that's a chance to engage and talk about it. NEYC emphasizes that caregivers should closely attune to each infant's developmental level and needs, providing both comfort and gentle challenges appropriate for that child. If concerned about a delay like not meeting multiple milestones like sitting or babbling, discuss with a pediatrician. Otherwise, celebrate each small step. Consistent, responsive caregiving and play are the best ways to help infants thrive in all domains. Now that we've explored how infants grow and learn during their first year, let's take a closer look at some simple ways you can support your baby's development every day.
Build strong bonds through daily interactions, create predictable routines, read, talk, and sing every day, celebrate every little milestone.
As parents, we celebrate every little smile, babble, and new movement our babies make. But sometimes you might wonder if your baby is developing the way they should. It's important to remember, every baby grows at their own pace, but knowing when to seek a little extra support can make a big difference. Here are a few signs that it might be a good idea to talk to your pediatrician or a child development specialist. If your baby isn't smiling by about 2 months, if they aren't making eye contact or showing interest in faces by 3 months, if they aren't babbling, laughing, or making sounds by around 6 months, if they aren't rolling over or showing interest in moving by about 6 to 7 months, if they seem unusually stiff or floppy in their muscles, if they don't respond to sounds or turn toward your voice by about 6 months, if they have difficulty eating, swallowing, or show very little interest in feeding, you know your baby better than anyone. If you ever have a concern, trust your instincts and ask questions. There's no harm in checking in, and early support can help your baby reach their full potential. Remember, seeking help is a sign of strength, not worry. Getting support early can open doors to services and strategies that boost your baby's growth and give you greater peace of mind. To help you along the way, we've gathered a list of trusted resources just for you. Thank you so much for watching and for taking the time to invest in your child's growth and development. We're so glad you joined us, and we hope you found this training helpful and encouraging. Be sure to subscribe to our channel so you don't miss out on future trainings, tips, and resources designed to support you every step of the way. New videos are coming soon. We can't wait to keep learning and growing together with you and your little one. Thanks again, and we'll see you next time.